Welcome to the Visceral Voice Podcast. I'm Christine Schneider, your host. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a biomechanics specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everyone, and welcome back to the podcast. I am unbelievably thrilled for this particular episode. It is probably the largest episode I have done because I am doing it more like a documentary because of the magnitude of what is discussed and talked about in this episode, as well as allowing you to see into some of my own journey and letting you see into some of my most vulnerable places. And I am so grateful to the amazing dear friend next to me, extraordinary colleague whom I trust very much. And as you will see through this episode, who I feel very safe with to be able to do a lot of the processing that I am doing through this whole experience, the extraordinary, wonderful Dr. Hilary Pata. Thank you so much for being here with me and having this extraordinary discussion.
Oh, it's my pleasure. I'm so happy you're here. Yeah. It's something to have, like as friends and colleagues when we're in courses or we're in different places where we're meeting, to come back to my hometown and my practice and my world and my dog and my, friends and restaurants and places. It's a privilege. So, yeah.
Thank you. Thank you for inviting me into coming to enjoy your home and your friends and your family. So I would love to start by letting the listeners know a little bit about your journey into dentistry, the work that you then transitioned into with oncology, and then, of course, to the absolutely unbelievable work that you are doing now.
That's a long journey. So when I was in university and I was studying arts, I took a really cool program called Arts One at UBC, and that integrates history, philosophy, and English all together in big works of literature. And that was a cool experience for me. And I also didn't really see myself knowing what I would do with an arts degree. And I had quite a curiosity actually about science. And I had a job that was Tuesday through Saturday. So on Mondays, I would go and just like job shadow at different jobs in town, friends, like parents and whatever different things. And when I went to go to job shadow in dentistry on a Monday, it was really cool because I've had really, really, really bad dental experiences in terms of how they've landed with me. Like I have a really hard time getting frozen. I'm really scared of it. I had lots of decay when I was a kid. And my brother didn't. And so it was like there was shame around it. And I never got into the cavity-free club. And I never got there was a lot of shame around dentistry for me. And it was really hard and painful. And so when I saw it differently, like for other people, I saw this like people walking in the door and trusting the staff, and there was a lot of personal interaction. Like it didn't feel like my experience of dentistry, but I saw, oh, this is what it could be for other people. And then it's little, right? Like I love making Ukrainian Easter eggs. I love crafting. I love like give me like a necklace that's gotten tangled. Like, I would just let me sit with it for fun. Like, I just love that kind of thing. And so then I actually knew some people that were interested in dentistry, and I was getting more further along in my arts degree, realizing I should really figure out what I'm going to do. And then like, I like the idea of helping people and knowing how to respond in emergency situations. There's a certain confidence that comes with being, a first responder or someone that's, in charge of emergencies. So I love that. And I was thinking about that, and it was not that far of a reach to think about other healthcare fields. And so then when the idea of dentistry came up, I thought, well, why don't I see what it would take to apply for dentistry? So from an arts degree, I had a certain number of electives left, and it worked out magically that if I used all of my electives for the prerequisites for dentistry, I could actually apply. And then the cool part is they don't do it anymore, but there's an exam called the DAT. It's like the SATs or the MCAT or the LSAT. It's the DAT. And at that time, you carved. So you carved, you're given a two-dimensional or a one-dimensional drawing of a three-dimensional structure that you needed to carve onto a wax tube. And like, I love that. So it was like a reward for myself. I've studied each night, and then I'd sit down and practice. So I'd get someone, I would like draw me something that I need to carve. And then they would draw it for me, and it'd be angles and measurements and stuff. And I loved it. And so I ended up with like whatever the percentiles are, being like the measurement that the 100th percentile was measured against my year. So even though I was kind of unlikely coming into dentistry from arts, with my prerequisites bumping up my GPA because you could actually get stuff right instead of just okay. And then I had this awesome DAT score. So they interviewed me, which was really cool. And then I got in. Those were like structured years, and lots of things came and went, and I made really amazing friends, 5 girlfriends in particular. Yeah. Then I ended up doing a residency after school because I knew that I wasn't going to live in the city. And so I thought, what a great opportunity to actually live in Vancouver, go to the restaurants, go to the shows, enjoy it as a place to live, as a fabulous city, and then know that I wouldn't be there. And what ended up happening is I ended up having experience working at BC Cancer, which became really formative for me. Amazing mentors, teamwork. I loved the teamwork. I loved sitting down to discuss cases with med-oncs and rad-oncs and surgical team and nursing team and different like medical SLPs, like different opinions on how to treat stage. And I was like, this is amazing. I love that. So I really loved that. And it was there's something that felt really good about being like in the public healthcare system and being able to be a part of care that people didn't have to pay for, that they could afford anyway. Yeah. So that there was an element of that, and just felt like teamwork. And so that, and then I ended up, that brought me back to Kelowna home, and then ended up settling here and
you were
family
with oncology and at the Cancer Center for
25 years, and I still work there. Yeah. Yeah. A much reduced role because of how busy this stage of life is. But there was a time, so I practiced like very high level. I had awesome mentors, people in town, people globally, who mentored me in having really high standards, which is also really risky for dentistry, right? You can have unyieldingly high standards of yourself and think that, like the story about these 2 people that live across this valley from one another, and one's a dentist and the other's a doctor, and the doctor's out like relaxed and able to enjoy the view and whatever, and the dentist is like fretting and going like, oh, and the dentist is worried because like a crown margin broke or like some silly thing, or like they drilled too deep, and the physician, somebody died on their table that day. But there's something that's trained the physicians to be able to move through that, like the way their mentoring happens after, that there's more, not to say that that's ever easy, but it's accepted in medicine that some things won't work out, right? It's not that accepted in dentistry that things won't work out. It's really not. Like, people think that dentistry should last forever once done.
Yeah.
Or maybe preferably never even need to be done. And then if it has to be done, then it better last forever. Like, it's, yeah.
And then dentists
like,
things a lot of times too of, you just strain the teeth, or you get a denture, or you get a implant, but not knowing the concept of neurodontics and the importance of what's really happening.
Yeah, like those words were not even. The one thing that I would say is that my education and the people who mentored me and the people who I've trained under that have been really big influences in my life have all been really strong in terms of knowing that it's a human being connected to that mouth. And that the reason we care so much is because it's a human being connected to that mouth. The reason we drive ourselves to those standards is because we know and we care so much. And so that is a really strong, like, part of pretty much every dentist I know.
But challenging across even across the world, that really, if you look at statistics of people who will burn out in their profession the quickest, dentists are at the top of that burnout.
Yeah. And suicide, second only to veterinarians who have medicine in their clinics. Right. That's what they say. I was at a dental meeting like a couple months ago, and the statistic was supported in that way. So like, it's a brutal expectation of yourself, but you want to do the best you can for people. Nobody wants to not do a good job for anybody, right? Yeah. And it's a really, what I kind of attributed it to is it's an intimate part of the body. Like, when people allow you into their mouth, and like the accent, like everything about it is really intimate. And for a long time I thought, I'm going to be such a great dentist because I know what it felt like to not be frozen. I know what it felt like to be terrified. I know what it felt like, and in good hands, like in good, well-intentioned hands. But it's also easy to be categorized as like difficult, or so many of the things, like if it's painful to get x-rays taken and you're trying to bite and stay still and you're a little kid or whatever, like if you have an oral restriction, like we'll probably get to talking about, it's going to be really hard to have an x-ray sitting in a pokey spot on your mouth and be right.
Yeah.
And if you have tensions in muscles associated with compensations related to an oral restriction. So there's so many things that started to get clearer to me that have impacted my health, my life, So anyway, like if we were to shorten it up from there, I feel like that gives like a really good picture of who I am, if it's not too wordy. But the end of it is that I had a really demanding career. I had a car accident to my neck. I couldn't really resolve ever the pain that I lived with in practicing general dentistry and the postures. And so my dear friend and I that were in practice together ended up selling our practice because we were going to have to either choose to renew a lease for 10 more years or shift at that time. So we made the choice to not commit to that, even though we'd invested a ton in leaseholds in the practice and thought we'd be there forever. And then that got really scary because I was still working at BC Cancer, and I thought, perfect. I'll just expand our scope of services at BC Cancer. We're ready for that anyway. We've kind of had part-time work, part-time help. Like I can just give myself over to that. There's so many things that I love about that care, and just take it easy on my body and not have to have a business and be a part of public healthcare system. And then that's right when COVID hit. And so we were still open at BC Cancer, all crazy PPE and whatever. But I was signed up to take a course because I'd started down this pathway. So if we were to say, like, the starter point for me was I took the first course in 2019 that this Kois Center, which is a place that I studied in dentistry, that they offered called Wellness Week. And it was so amazing. It was 5 days where we, the first day they took blood samples. They were sent off to the Cleveland Heart Lab. We were doing blood glucose monitoring throughout the whole day and the week. We did oral pathogen testing. We had, so we were learning all of these things that were so foreign in 2019, like microbiome and the connection of that to gut health, mental health, cancer. And then we were learning about like inflammation in the body. And of course, it's connected to microbiome, and then inflammation, and how if you have inflammation in the mouth, like, periodontal disease we knew it was associated with low birth weight babies, but to start to talk about it in terms of cardiovascular disease was really new at that time. And then all the different ways of looking at cardiovascular health and how is it actually metriced currently in diagnosis, and what are people saying that could be different, and just like mind-blowing every day until the last day when they started showing these pictures of, there's a situation in dentistry that's called a class 2. And it's when the upper jaw is ahead and the bottom jaw is below. And this is what I had when I was little. And so they showed cases of starting early. So in a class 2, I had a daughter who's a class 2. I was also a class 2. So it made sense. Genetic misfortune. That's just what it is. So she's sitting here in a class 2, and I'm saying, please, 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 can we do something sooner? Like, I'm just seeing her jaw be held back, her teeth are, and I wanted her to be able to start to have change affected. So we an orthodontist colleague of mine agreed to start putting on braces. And so the idea is that you either bring the top teeth back or try to bring the bottom jaw forward, or sometimes surgery is done, or like whatever combination of it. But in this course, he showed all these examples of changing the way they breathed, changing the way they swallowed, and releasing tethered oral tissues. And these class 2s would develop into a normal occlusion. And I was like, what? How is this possible? Without braces. Without braces. And I was sitting with this friend of mine from Italy, and on the break, I'm like, have you heard about this? He's like, of course I have. What are they teaching you in Canada? I'm like, my daughter, she has this, I just put her in braces, and now would this help her? And he's like, you've got to come to my clinic in Milan. I have a whole floor that's designated for pediatric intervention of like myofunctional care. I'm like, oh, so of course I had to, being like not unable to not take something on and learn
at that time. What did you decide to do with your daughter, who is at that point in braces?
Well, I came back with some books and some articles and from these courses, and I said to my friend, the orthodontist, like, what do you think about all this? Like, would you be open to, like, this is all new to me. Could we try some of this? And he said, I think we should just take the braces off and you're on your own. And that was scary.
Yeah.
And the other thing that had happened is I realized I'd given up my private practice. And now I didn't have a place to act preventively. I was believing that I was going to be, making a difference through cancer care and my ability to care for people in that way. So then, I started to have it was actually super depressing because I felt like I'd let my daughter down. I was starting to feel isolated in my community. It was COVID. I was grateful I didn't have a business to manage through that. But I also had no real outlet that felt like a connection during that time. I shouldn't say not, like whatever. It was just different. And then I didn't know how to care for my daughter. And one of the activities that was kept on was an outdoor activity, cross-country skiing. And I was coach up across our cross-country ski area, and that's big. We're a big family for that. And I'd started studying more breathing courses, and I'd found more mentors, and these courses were going online, and I was starting to just swallow up all this online education and realizing how foundational breathing was and how foundational posture was connected to breathing and posture connected to fascia. Like, I don't even know if I knew what fascia was. Like, now it's just such a common word. It's hard to imagine not knowing, like, but I have a feeling, I remember in anatomy, like we were cutting through everything to get to the muscles, to get to the nerves, to get through that side. Yeah. Like now you just think,
or fascia that is not living is very different than fascia that is living.
And when you be desiccated.
So when you see it in the body with the fluid components to it and the matrix, the spider web, and it's incredible.
So what was kind of breaking open for me was to go, okay, well, just start making the best of what you've got going on here. So here you are at BC Cancer, and I've taken this course at the Breathe Institute, which is like such a leading organization in breath and oral connection, the ENT surgeon, Dr. Suresh Sagi. And so I just poured myself into that place, and they were like the first ones to develop an online curriculum to be able to start learning. So then I thought, well, now that I've learned, so they presented this notion of the tongue range of motion ratio, a functional way, because the criticism is, how do you know when a tongue tie matters? How do you know? And that is still an evolution that we're figuring out and discussing. But at that time, what was brand new to me was this notion of tongue range of motion ratio. So then I thought, well, I'll just start looking at BC Cancer. And everybody that came in had a tongue tie, like a really severe tongue tie, so the grades from 1 to 4, 4 being the most severe. And it's an objective test that you measure. And every single person had either a 3 or 4. I was like, oh my God.
They shouldn't breathe.
They couldn't breathe. They couldn't swallow. Their jaws got narrowed. They couldn't get their tongue out. So then I started correlating, I was learning all these other things to do. Like, you take a cotton roll that's 36 millimeters and you put it in forceps and you put it up between the two molars, the first molars, and it should slip in with ease. Well, I could hardly ever get a tongue, like a cotton roll between anyways. So now I know they've got this narrowed maxilla. And then you start saying, okay, and then we're learning about like mouth taping for nighttime to keep your mouth closed and nasal breathing. And so then I start looking at their medical histories. So actually this became a very interesting scenario, because what I used to do is I would look at their panoramic radiograph, it's called. So it's a scan that like lays the globe out like a flat map. So it takes the head and lays it out like a flat map. And I would look at it, and I'd be looking for infections, things in the sinuses, what was going on with the nasal septum a little bit, like what was the state of the teeth, what could you predict about gum disease. But, I'd been really highly trained to like methodically look through an x-ray. So what I started doing is I started saying, I'm going to look at their medical history first, independent. Like, I would look at them kind of together. I'm going to look at their medical history first. And I'm going to predict what their dental panoramic film is going to look like. And it's like not that fun of a game, because there's so much structural evidence when you see they're on omeprazole, they've had chronic reflux, they're on CPAP, they have obstructive sleep apnea, they have, they've had hernia surgeries. They've had, just like the common basket that we see all the time with oral restrictions leading to dysfunctional swallow and dysfunctional breathing, and the structure that accompanies that. So then you sit there learning all this stuff, realizing you don't have a practice to implement this in, while I would go to the one outlet, which was cross-country ski coaching, and then be watching the morphology of these kids who are trying to do a pretty demanding sport requiring both balance, breathing, and a lot of coordination and vision, stability, and starting to see the commonalities, the kids that were struggling and the postures and the open mouth and going like, oh, great. And I cared about them all. And so most of them were in my practice that I'd sold, that I was feeling badly that I was not practicing anymore. And feeling like, have I made a big mistake? And like, who am I now? And what am I going to do? And how am I ever going to help people? And now I've, went from being kind of like a pillar of society in our community that had a really respected practice to kind of like, I felt like I was hiding. And yeah, and shame's a sticky emotion. And I felt very ashamed of not being able to affect. Like when I think about the whole reason why I even wanted to be in dentistry was I saw myself connected to people and community and being trusted. And I was like, oh, so it was really hard. That was really, really hard times. Plus, I'm trying to figure out how to care for my daughter.
Yeah.
And like lots of the parents were feeling and understanding what I was going to do, but it was super early on in this. And I didn't. And so then I was like going to be starting, maybe redoing this in different modes and thinking, what am I ready for? I don't want to have a business again. And I thought like I wasn't a very good leader anyway, and who'd want to join me again? But then all my team started peeling away from that clinic that I was at and coming to join me. And then I was like, oh.
So we had this caterpillar enter into this cocoon of everything you're describing.
Yeah.
And then the cocoon starts to open.
Yeah, which is scary. Scary, right? It's really scary. And so I would say it's been a very, very, very hard journey. A very, very, very hard.
Yeah.
Really, really
But
hard.
as this cocoon opens and this butterfly starts to emerge into the exceptional workplace that I'm at now, I know it's when you started looking at these tethered tissues and breathing, what made you go from there to start thinking about babies and infants?
The biggest phrase that you hear when you get into this work is you can't unsee it. Once you see it, you can't unsee it.
Yeah.
So you would have to have the ability to not listen to your inner self once you've seen this, to not do it. And then you realize it all starts in infancy. So then you have to start treating infants. And then that's scary because it's super controversial. And it was already a really polarized time for medicine and all kinds of things happening and people getting categorized into how they were thought of and with whatever. And it was so hard to realize that not everybody was coming along this revelation with me. And that there's some really entrenched schools of thought that don't respect a dentist in the arena of a infant because they don't have teeth. Yeah. So I wanted to learn from like everybody that I could, as any good little dentist would want to. So then I started looking for every mentor that I could find, every online course, anywhere I could manage to get to travel to. I had I pushed really hard to find people to mentor under. And then it was funny because one of my mentors, who's a dear friend now, I actually heard about her on the Gwyneth Paltrow Goop podcast. Maybe it was during COVID. And a friend had heard it and sent it to me. And I'd said, I've heard about her and I'm actually going to be meeting her in a few weeks when I travel down to California to be with Dr. Zaghi at the Breathe Institute. And so her name's Sherry Sammy. And so then I ended up asking if I could be mentored by her. And the big thing was I wanted to know if my infant releases were good because it's not a slam dunk. Like some would get better right away breastfeeding. Some would latch on and it'd be easier right away. And that's what you want to hear all the time. You just want to see it get better right away for a mom. And you want the reasons. And then if they don't, as a dentist, you assume it's your fault that you didn't do a good enough job. because I knew he needed body, like physical therapy, and we would have that. And I was trusting that the physical therapy people knew way more than I did, of course. So and they'd been doing it longer with another colleague, a little bit north of here. So I thought, well, you know what? I'm so lucky because I'm not going into this naked. I'm going into this with some people who are already like experienced, and they're the physical therapists and the lactation support. So then I started, you don't get always great results. And I'd be like, why does that one look like it's reattaching? And the parents were like, sure, they did the stretches. And I'd be like, I would literally like say like a little prayer to myself, like, please let there be no reattachment when I walk in to check the like recalls from infant releases. And I'd like bought whatever laser they said you should have and like just wanted to be able to do the best that I could do for people.
I want to we can pause here and just let the listeners know when we're talking about tethered tissues.
Oh, yeah. Mm-hmm.
What exactly because there are more than one tethered tissue.
Yeah. So in the mouth, there are 7 sites that could potentially be tethered. So there's a tethering is a frenum. And a frena is made, what we described, it's a mucosal fold. So the mucosa is on top of fascia that may draw muscle up into it or not. And so when we see a tension like underneath the tongue, there's always going to be a frenum. It depends if it's restricted in either anatomy or function that we call it like a tethered oral tissue. So you can have it on your upper lip, you can have it on either cheek, you can have it on either cheek down here, and you can have it here. And those are really common sites for people to need gum grafting later in life. Gingival recession.
Yeah.
Yeah.
So we had talked about, or you had mentioned the tongue, and that there are different stages of the tongue, 1 through 4, and 4 being the most.
Yes. In like children and adults, like ages 12 and up, that's what the study determined. So it gets harder below that, how people agree.
And so back to the tongue, are there also stages in the other tethered tissue?
So on the upper lip, there's a grading system for infants, and it's measured on like the height of how it connects. And so, but you can add lots of qualifiers to that, like how you describe the tissue. Is it broad? Is it tented? Is it thick? Is it thin?
Tented.
It
comes like
it comes up like a big V. Like often people will actually get food caught underneath where it tents, like it's so tight. And so those are qualifiers. Once you have teeth, then the same grading system can exist. But it's now that there's like teeth involved, it can shift in the way it appears. But if the attachment's still really low down, like close to the edge or tucked in, then it'll stop the teeth from coming together.
Which is what my daughter has, which is what I started seeking out my care for. I had a hard time latching when I was a kid, or at least my mother always said, you were a biker. I always know then you were going to bite me because your eyes would just fixate on me and then you would bite, which to me says
vision is connected to swallow.
And instead of and a sympathetic response that I couldn't get the food that I needed. And my daughter also, I wasn't able to produce milk for very long. And her lip tide does come down and her teeth are separated.
Yeah.
And so for me, instead of looking at sending her for braces, I'm looking at why. Why are her teeth not coming together? And I can see that tethered tissue with the little button on the bottom coming down through. And so
lots of people are asking that question, right?
Yeah.
Lots of people are saying, what's the root cause of this? Like Kevin Boyd is an amazing researcher, and he has taken all these studies of skulls at the Smithsonian and older skulls. Like, we didn't used to have a lot of crooked teeth and malocclusion. Jaws used to form and have really nice arches, even including wisdom teeth. So you'll see things like I've had I've heard articles where they'll say, well, if it's a concern when they need braces, that's like, how have we accepted braces as normal? And wisdom tooth extractions has become normal too, right? It's just,
Yes, I've had wisdom tooth
most people have.
My family has.
Yeah. Like most people have. Me too.
Yeah.
Yeah. Like,
I would love to come into first. Let's take a look at an eyelid releases.
So we first started with Orlays treatment. While I was in Hillary's clinic, I had, maybe 3 or 4 different Orlays treatments before, so pre and post releases, so lip releases. And Orlays, right now, what we're actually showing is the intraoral of the Orlays, but it is a whole protocol that actually starts down on your wrists, and it also includes your face and the occipital region and intraoral. So I was really grateful to have the opportunity to have Orlays before my actual tethered tissue release. Now you'll see the actual lip releases here. So what I want to point out here is that I have a doctor of osteopathy at my head, and I have a craniosacral therapist at my feet, as well as, of course, Dr. Pata, who is doing the oral tissue releases. I had an upper lip release and a lower lip release, and then there are 2 other folks in the room assisting. One observing and one assisting. So I felt really supported. This is important, a really important component in my opinion. And of course, when we get to when I was first introduced to my ALF, I will talk about this further. But having that integration, I think, is key. And of course, Dr. Pat is also trained in cranial osteopathy or cranial sacral therapy, and you'll see her at my head when I actually am introduced to the ALF.
So coming back from seeing my lip releases, I love we started to bring up braces and how that became norm. If you have this beautiful image that you shared with me, maybe even just last night or a couple nights ago, of wanting to work with bonsai.
oh, yeah. That I was like maybe thinking about a new hobby.
Yeah.
To take care of this, this aging
And how it would keep a beautiful small bonsai small.
Yeah.
And growing up into something of its potential.
Yeah. So like a bonsai tree isn't a different species. It's the same species you would see. So the example that I saw is this, I thought I would be interested in bonsai. So I went to this bonsai club and saw all their examples, and they're sharing them and showing them so proudly. And I looked, and I love plants. So I thought this could be perfect. And it's like meditative, and it's small. And so when I said, oh, is this a blue spruce? And the guy's like, yeah. And I said, like a different species or a different and he said, no, this is the same one you'd find out in the forest. It's just really small. I'm like, how does it stay so small? He said, well, we just don't let its roots grow. We just keep it in this little pot. I realized, oh, wow. So like it never leaves this pot. Okay, I get that. And I said, well, why is there wires on the branches? And he said, well, because that's the shape that we want to put them into. And I said, do they ever come off? And he said, no, otherwise they would change their shape back to what they would do. And so then I'm like, oh my gosh. And then I realized this has become less attractive to me. This form of bonsai, I don't know if there are ones where they don't wire them and keep them in small pots, but this was certainly the way that this method.
And they look so beautiful in these small pots. Right?
They do.
They're all
controlled and planned. And yeah,
that's exactly what
like
you're doing, braces, is that we're making something look very beautiful, but are we potentially limiting that individual's potential throughout their full body, down below those braces and up above those braces.
Well, and I think that's the big thing. Like, I know you interviewed a colleague of mine, Mike Cantrell, and the big thing is that what it's really come down to is the mouth is actually a really big player in showing us symptoms of a bigger cause. So we now know that there's some genetic predisposition to a dysfunctional swallow and poor breathing from like restrictions and habits that form from those restrictions, or whatever other early lifestyle choices, whether it's inability to breastfeed, as you described, or challenges feeding. And I mean, it's such a large topic, as my mind is really going through a lot of thoughts to what is the most relevant stuff to share right now. But I would say if we were to go back to kind of completing the journey, ending up in groups of colleagues who do tethered oral tissue release care and breathing, eventually you get to something called ALF. Yeah. There are other ways to go. Like there are routes that are more force-based. Like you can head down more surgical routes. You can head down more like force metric. And some of those are going to work for some people. And the dentist included, or the surgeon included. For me, what works best is to really try to work with nature and to allow the genetic potential. So it'd be really interesting. Like part of me wanted to free the bonsais, so I take them and see what would happen. Could they return to their genetic potential if you actually gave them space to grow and took off all the wires? Yeah. And so the method of care that I've ended up with is really neat. He's credited with being the inventor, Dr. Derek Nordstrom, of what he would say is it's an appliance that dentists place that activates. It's a neurological device. Like it actually activates the brain, the cells. It's not about putting force on the teeth, and it's not about trying to move the teeth. It's about opening up systems to allow them to reach what their genetic potential would be.
The most natural form. Let's take a look at Dr. Derek Nordstrom discussing at a conference that Hillary and I had the great pleasure of being able to attend. Go ahead and describe this about the ALF.
So why isn't this better known? ALF is the closest in nature of any orofacial functional orthopedics known to mankind. It has the greatest number of options, which a lot of them you don't know because I don't even bring them out. I'm like Mary Poppins or something like that, and I have this bag. Yes? And some of them I don't bring out because it's already too confusing, or it's too, yes, okay. So, and it's hands down been associated with more miracles than others combined. So that's the other big question. It's like, why even bother doing the other ones if they're not doing the miracles? I mean, isn't that telling you something? It's not like we're looking for the miracles, but honestly, the patient would like them, especially when they have healing. Well, you just saw one.
Yes, and so powerful for me to hear that. And he talks about the magic that happens,
right? And he's like holding himself back.
Yeah, he's so excited about being this Mary Poppins, this Dick Poppins.
Yeah.
And the magic of what can happen, and saying it doesn't always happen, but wouldn't it be extraordinary if we can provide this for all of humankind, to help them breathe again, to help them. So I also want to bring in that you had mentioned a little while back how much you loved working with this jewelry.
Oh yeah.
You would like to work with necklaces that had become
and knot them.
Yeah. And you would like to.
I love that.
Which is
yeah, in a way it is.
It's like we're doing with
we're unknotting a human's. Yeah.
So you mentioned the neurological component and a cellular component to the ALF. What other benefits do we have as I am speaking right now? An upper and a lower.
What have you noticed since you've had your ALF in?
You will see in this episode my experience. So maybe we'll cut to that for a moment.
So here I am giving my history to my dear friend and colleague, Mike Cantrell, and you will see Mike in the room with me when I get my ALF. We have already discussed that I fell on my face and had an injury at age 4, which killed the 2 front teeth. I had the front teeth pulled at age 7. I was in a bus accident at age 8. I've been in several car accidents. I had an appendectomy in 8th grade. In 10th grade, I had surgery for pectus excavatum, which removed the costal cartilage of 12 ribs, along with the xiphoid process and wiring the sternum to bring it back to neutral since there was a 90-degree rotation. I had a severe head injury resulting in full body nerve pain for 2 years in 2017. And I've had several mouth tori, including palatine, maxillary, and mandibular. And then you see here, Charlotte is there. She is the myofunctional therapist saying it was the worst palatine tori she has seen.
If you met me on an elevator and said, well, I'd be interested in getting somebody to kind of work on me, and then I said, well, gee, how come, Christine? You would say, because I'm only going about the 5th floor. So, yeah, gee, how come, Christine? Why would you like someone to work on me? What's wrong?
From here to here, I have a lot of scar tissue. I have a lot of pull. Most scar tissue pull here and membrane pull here. And I feel like I got rid of this tourniquet, but now I have this tourniquet.
So there is this tourniquet, this compression, this squeezing phenomena that's happening between your sternum and the top of your head.
Yeah, totally. Okay, I think that's what you did great. Oh. And what about you, Christine? Do you notice anything having those in?
I definitely feel calm.
Oh, there you go. Oh, she's just about to do it. She's just about to unravel her flared right temporal. Yeah. You should totally let that out because it's so ready. You just do that, my friend. I will hold your neck, I will hold your head, I will do whatever. You just let those tears flow. Don't even try to hold them. Just in case. Yeah, let those flow. Yeah.
Sorry, it's been so long since I can trust anyone around my head.
Yeah. You don't even apologize. We're so honored to be trusted. And like really let them out because it's gonna help everything so much.
I like that. Why would you bother at all with it?
Oh my gosh, look at your left temporal, just let go. Keep. Yeah, let it go, let your chest, after all that release today, let that chest of yours rise and fall with your tears. Don't try to suppress them in any way, because that's gonna like let you. Oh gosh.
Is that still on?
Oh, yeah.
I don't think that I could have.
You just lift your head for a moment. I just want to feel like I go.
I don't think that I could have gotten here without if I hadn't had the cranial with it. If it was just an appliance going in, I don't think, for me, with the amount of trauma that I've had come into my body, I think that it would have seemed traumatic to me because it was fearful to have anything around my head. So if I had gotten appliance without having the assistance, and I think that's a really powerful component in it.
So it was obviously a very emotional experience. And then I described how important it was for me. And you can hear, like, in my voice is starting to get a little emotional and crackly now. And it's not as smooth. I still have some layer off from that profound experience of having the outer foot in. And obviously the profound impact of having you and Larisha both supporting me in that. I immediately noticed in a shift in my cranium.
Is that a word that your listeners would use, cranium? I'm just curious because I know that you're yeah.
Half of them would use cranium.
Yeah.
In my head.
Yeah.
I noticed the shift where I didn't feel this. Because of a head injury, had this exceptional pull through this left side of this, and this. It felt like the tentorium was just being driven down.
Yeah.
And it shifted, and I felt a difference in that right away. And then I have always felt I have a certain amount of scoliosis with the pectus excavatum, and I've always had this pull down my left side with that rotation. I'd come out of quite a bit of rotation, but still have some. And the whole chain of musculature down my back started to soothe into the chair. And I felt like for the first time ever, my rib cage was at the beginning of potential of unwinding. And, you know, I had always described this tourniquet around my chest. And then with Mike, I described how the tourniquet changed from this way to this way since that head injury. And I felt that unwinding start to happen.
That's the weird thing, right?
Potential in it.
Yeah.
And with my lip releases, I've always been a forehead talker. And to the point where my mom would say, stop speaking with your forehead. You're going to get wrinkles way before your time.
Oh, I see what you mean. Like the way that your forehead gets wrinkled up.
And I almost feel like I had like natural Botox. Like as soon as the lip was released, my forehead was finally able to soften. I've always been really insecure about the tightness that I had by my lips. In voicing, you're told that if you can't ooh, like all beginners, you're still a beginner if you can't do an ooh vowel. And I couldn't do ooh vowel. I could, but it was so tight to be able to do ooh. And then I felt my midline structure start to soften. And for the first time, I had ooh with the Alf. The first time you and I both at the same time noticed that I felt like I had swallowed.
Yeah, that was really cool. It was so obvious in holding your head.
I can get
when you swallowed.
the middle and backish part of my tongue can feel my tongue.
So, which is a really interesting point because we haven't done a tongue tie release. We released your upper lip. And as you described, that fascia being able to relax. And that's one of the things, you know, we talked about sort of the weight of the dentists put on themselves, but like, great. So now we've learned, like, not only are we affecting the whole body by what we do in the mouth and to even feel more responsible, but we have the privilege of having the tip of the iceberg of 7 connected fascia lines through the body showing up in our domain, right? And so it then becomes our responsibility to start to decide how, if, and when those should be released, and like then get good at it. And then there's a lot of like
and be able to
part of it.
afford to purchase certain lasers that then can go through protocols
to soften the body, to put you on the
before you ever even go in.
Exactly. That's huge. That's a huge, huge point. Yeah, because we know the importance of physical therapy, like body care and body work in conjunction with any releases, because it's letting things release the diaphragms of the body from the feet, the pelvis, the respiratory diaphragm, mandibular diaphragm. And like while you're talking, my mind is going again to so many places. Like when we think about the conference we were just at in Utah, there were so many professions represented, and every single person is unraveling what they knew about their own profession and what's been done for a long, long time. And all of a sudden, so there were dancers, there were vocals, there was, researchers, there was dentists, there's physical therapists, there was orthodontists. Yeah. So anyway, I think that
Optometrists.
Yeah, vision. Yeah, totally. Yeah, so it's one of the metaphors that I use that maybe would help people understand my perspective on ALF is I think of it as like, if you have a bicycle, if you think of the body as a bicycle, and the bicycle has the tire and the wheel and the spokes to the hub, to the forks, to the stem, to the handlebars. And if you think of the body and you think of the upper jaw or even the lower jaw as the handlebars, and if you hold on to the handlebars of a bike and at the handles, and you make the slightest move, you really change the trajectory of the bike. And so that's kind of what we have here in the mouth. But the other part that we use, so we're moving the bike without touching the ground, but it moves through all the systems of what gets there, kind of like our body. But the other thing is that you pump the pedals that go to the cranks, that go to the drive shaft, through the chain and through, and all of those systems to get it moving and pulsing. And that's really our tongue. So we have the ability to drive an entire body through holding on to the molars, which connect to the bones of the skull, which turns out they move, which we don't learn in medical or dental school. So then, I think, well, say we're like a bicycle, and we have, that's where the responsibility of the dentist then falls into not only these tethered oral tissues and understanding how to work with a body to soften them or prepare them before and after release, when necessary, when not necessary, what do you use, how do you do it, and and then figuring that, oh my gosh, these subtle movements that we can make in the mouth, as we've seen, and you'll be showing some of those to your listeners too, that for your viewing audience, that vision training, the way we move our rib cage, how we breathe, how we put weight on our feet, like it almost gets to be too much again, right? Like you go, how could, but the thing is, not one person can be responsible for it. That's where we have teams. And the coolest thing is when you align with people who, once they've seen it, can't unsee it, they flock to you. And the hard thing that I found then was, okay, but now I'm like the head of this and I'm responsible, but I don't have all the answers. And I'm not even very good at this whole ALF thing yet. And I don't know how to bend wires, and I'm trained to, have kind of immediate gratification in dentistry, like see decay, do fillings, smooth them up, floss them. They feel great. That's done. Like that, like I would leave dentistry feeling like I finished stuff. And then this was all like, I'm just starting stuff. And then hoping that it was working out. And then it was just so many variables. And so it's a super big privilege to be at the place where I feel I'm at now, that I have found so many people that can't unsee it, that have made this commitment in their life to show up from their profession and collaborate and build teams,
but build your teams and work on, the physical therapists, massage therapists, all of us who are doing body work, personal trainers who are doing the body component, being able to work with a dentist that provide that kind of support of the body with the ALF in place.
Well, and that's where I would say for me also, I'm not there to treat the body. Really, like a dentist's scope of practice goes to the clavicle. And, we can be contacting people and touch but it's you like, that's why I don't do any of the body testing. I have to train my team or have people that will do that for me. Unfortunately, I have a physical trainer on my staff who's also a yoga instructor and breathwork and CDA. But I just think that it requires a team, like even just the lab work. Yeah. Like it's hard to even find somebody, like we're working to train more people to be able to make elves. And it's a very, very specific wire and the amount of solder and the heats that it goes to, because it's live. Like it has power in its lack of strength. Kind of. Yeah. But that it respects the human form in terms of allowing the tongue, kind of what you described, that your tongue is attracted to it. So it attracts a tongue, even if there's been no treatment done to the tongue, it attracts it to the roof of the mouth to start pumping those bicycle pedals. Yeah. Which is your best expander. The tongue is the best expander.
So it's bringing the tongue up to do this expansion itself instead of having to go through something that would be more manipulative of more a rapid expansion.
Yeah. So I don't do any of that. That hasn't been my call. Like that hasn't called to me. And so I really love, like the first time that I started being trained by a friend who's a colleague in craniosacral therapy, and she's also studied osteopathy, even though she isn't an osteopath. And we started putting these ALFs in, and it was really shocking for her. She started to think like, well, what do I do now that the cranium's unraveled with this appliance? And then she realized, oh, now I can get into the diaphragms and handle the body. And so I mean, it's so powerful, and I get why Dr. Nordstrom in his talk kind of says there's so many things he can't even get into discussing, and the magic of it and the miracles. Like it sounds all woo woo, but that's what's interesting involving the physical therapists. Is we had a discussion just earlier about a case where all these complex assessments of the body that we really want to learn and develop our teams to be able to do to support ALF care and therapy. His perspective was, that upper ALF's not doing anything for this person at this time because all of her body measurements were the same. So then I was able to share with him what has actually happened with her in her own psychological unraveling of her memories that she didn't realize she had, and then her ability to ask of her family. And they were able to affirm that these things that she was feeling were actually real and all this. And then it gets into this whole like, wow, so fascia, we know, like Gabor Mate will tell us all, right? And Gabor Mate will be the first one to show. And I mean, there's many other people who are researching fascia and able to prove that it holds trauma, whether it's emotional or physical, it's held in your fascia. So we can see tensions of a tongue that might be an emotional fascia tension. And so being able to unravel those with gentle, non-surgical laser care is really important, but it's also part of unraveling the body, unraveling the breathing, sorting out, the body. It's been to a place where it would be really overwhelming, except that we have such strong teams emerging to teach and support one another, that's growing globally. It's an important. It's a game changer. Yeah.
Because when you think of learning something, we all like to have, or not, maybe not all. I shouldn't say all, but I like to have a protocol. I like to have organization. I'm totally. I want things listed out, and the ALF doesn't have that. I can't look in a room full of people. If everyone has an ALF, I would not see an ALF that looked the same as anyone else.
No, it's principles.
Yeah, it's completely based on that individual human
and their presenting condition and their stage of dentition, their stage of body readiness, and like what the goals are, in a way, which are always to try to just tap back into the origin of that person's genetic potential and unravel whatever gaps, whatever things have fallen since who knows when, right? So it's It's a hard thing to make, but I would say that what's really thrilling, I think, for Dr. Nordstrom more recently is to be aligned with Applied Integration Academy, the AIA, because it's the closest that I've ever seen to protocol that allows for being like a reference book instead of a recipe. It's like you're just being given the ingredients, and then it's just being able to respect what, and then you spend the rest of your life mastering it, which is why it's so much easier to just catch it all in infancy.
Yeah.
Yeah. Which they're neonatal ALFs, which you've seen some impacts of, and, you know, being able to unravel those craniums and those eyes and those swallows from infancy. And I'm just starting to realize how, you know, when it matters to include one of those for success, one of the variables I'm starting to think is if it's an infant that's been unable to breastfeed, and if they have, they're bottle dependent, if that's the method they're being fed with, then it's something that I think is actually important if we're doing tethered oral tissue releases to support the success of the tongue going up to the roof of the mouth. Yeah, because they don't really need to do that to bottle feed. So, yeah.
So before I had one more question.
Yeah.
With Applied Integration Academy, there is now, or they are continuing to work on a map so that people could find the bodywork therapists, the dentists, the optometrists, all who are working together as teams to provide this care. But what would you say to everyone listening of how do they find good care for an ALF right now?
I would ask if they are open to collaborating with like who they work with already in terms of having physical therapy support and vision therapy. And if they're open to osteopathy, for sure, craniosacral therapy and osteopathy. I've trained with like everybody out there that has any kind of teaching place, and there's differences and there's similarities, and everybody wants to help someone be the best version of themselves. Everybody that I've ever met doing this work, they all want and believe that there's a different way to unravel teeth and skeletal form and cranial form and possibly the body than we've been taught in dental school. And I think that everybody has the same goal for their patient, which is to make them better than they were when they started.
What would you advise a dentist who is wanting so badly to do well with ALF?
Good. So this is what's so nice about your family. It's family. So you've got a support network. And I think that's the coolest thing, is that we start the training, but each of us by our natures are not going to hear the same thing. And so when you have a family, we're not talking about the blind leading the blind. We're talking about, or like kids do on social media, definitely blind leading the blind. But we're looking at professionals who are saying, well, this is what I understood. And that was the cool thing about her dad, Gavin James, Rolly Albert, and Dennis Strokon, is that they would get in the airplane and they would fly down and we'd talk. And they'd go over cases, what about this, what about that? And so what I'm trying to do, I'm not the person who really is comfortable in the limelight. That's part of the reason I'm kind of here. So I would prefer to work on patients directly, but I can see that what really makes me happy is working together with you guys. And so I think if, as you design that and you start submitting questions, and we're family. I mean, we can say, hey, you need to do a Mentos right now, whatever it is you slept with your mouth open. But you can say that to each other, and we're gonna be okay. And we want that, because that's really how that's gonna happen. Does that make sense?
Yes.
Okay.
Yes.
And I'm dedicated to supporting you.
What do you want to be remembered for?
Wow. So I came up with a quote a long time ago. Now it's a religious quote, so hopefully it doesn't offend anyone. But this quote is, "The Savior saw sin as arising from deep unmet need." So my quest in life was to understand the unmet need. You don't fight these things, just like you don't fight with Alf. What was the unmet need? So I like to say disease arises from an unmet need. That to me, I just yearn so much to understand what is that unmet need.
And we just want to keep feeling that what we're doing is allowing the body to open and to remind itself as it releases fascia, cranial strains, body strains, fascia strains, muscular habits, memories, that we're just hope we're nudging people in a better direction for their own healing journey, which is really their own journey anyway. Like, we're not actually trying to force anything. We're just allowing it and nudging them along with each little handlebar.
Yeah. And that it is a duet.
Oh, it's a quartet, or I don't know, a quintet, a sextet.
Yes, that's true, because you have many practitioners. But also the person in which, when I was on the table getting an alcohol, my input was just as important. And
totally
important to know as an individual.
You want to be able to be with someone that you can be heard. Yeah. And what's so cool for your listeners is that what creates resonance in the cranium creates resonance that is shaking all those little sutures of the skull. And it's so good to breathe well and hum with your mouth closed, with your, through your nose. And that combination is what is part of the trajectory, which is why we want the body to know how to breathe and hum well and have that resonance and strength and grounding. So, yeah. Amazing. It's a big topic. Congratulations for your journey to finding it through your work. And that's what makes our groups so interesting, is to have all these interdisciplinary awakenings of like what we're impacting when we work in the mouth. It could be overwhelming for a dentist, but when you realize that actually the universe is on your side, wanting to unravel all these good humans to do this good work, then you can relax a little bit into the communities that are forming to do this work together.
Yeah.
I believe that the spirit is reborn when we die. And I believe without a body, we're free to fly. I believe in the people standing tall. Times like these, hands are raised with intention to heal the world, heal the world.
Thank you so much, Dr. Beale, for having this conversation with me, for coming on and being able to have such a grand episode, again, the biggest one that I'll have, with all of the layered in other testimonials of dentists and people. And I just think that it's important to just get good, solid information out of knowing that we're here building teams and trying to take the best care of everyone that we can, as I know that all of you are too. So thank you all so much for listening. I'm so thrilled that you took the time to hang out with us on this journey of this episode. Is there any last?
I was just thinking maybe we could end it with two of my favorite quotes. So if you can show those, I'd love that. Yeah.
Great.
Thanks for tuning in to the Visceral Voice podcast. If this conversation resonated with you, please subscribe. It's free and it helps us keep sharing meaningful content. A quick rating or review also makes a huge difference. Share this episode with your colleagues, students, and friends. Join us on social and visit www.thevisceralvoice.com to explore programs and upcoming events. I hope you'll join us next time for another inspiring conversation on The Visceral Voice.